presentations.
Okay, so I am, for the record, Kevin Black, staff of this committee. I'm going to address just Senate Bill 5624, which enacts recommendations of the SURSAC, or Substance Use Recovery Services Advisory Committee, which did meet 65 times between 2021 and 2022, including meetings of its 4 subcommittees, and submitted a final plan with 16 recommendations to the legislature earlier this month. So your bill report details all of the provisions of this bill. Rather than spend the next 15 minutes going over those, I will give you some high-level highlights and also provisions which have not already been covered by Joe, which are common to the other bills. So some of the things that this bill does is it provides counsel for parents and guardians who are affected by substance use disorders, independency, and child custody cases. It creates a tax exemption for real and personal property used for a recovery residence and funds new recovery residences around the state. It makes opioid overdose reversal medication available for caseworkers of the Department of Children, Youth, and Families. It removes the prohibition against giving away drug paraphernalia from a Class 1 civil infraction, as Joe already mentioned. It establishes and funds mobile or fixed site health engagement hubs that would provide opioid treatment services in locations around Washington. It would create a statewide directory of recovery services at the Department of Health. It would convene 2 work groups at the Healthcare Authority, the first to streamline substance use disorder treatment intakes, and the second to make recommendations related to providing a safe, regulated, and tested supply of controlled substances to individuals at risk of drug overdoses. It would also recognize opioid treatment programs as essential public facilities, as highlighted already by Senator Wagner, and take other steps to both expedite and fund the construction costs for siting and placement of opioid treatment facilities around the state. So one of those requirements for citing opioid treatment facilities, particularly relating to methadone, is to have public meetings, and there's language to that effect in the code, which is stricken by the bill. To actually get a full list of current law requirements for starting opioid treatment facilities, I will have to consult with the Healthcare Authority, and I can get you more information. Apart from that, the bill does contain a number of other provisions and details which are gone over in your bill report. There is no fiscal note available at this time. I'd be happy to answer any questions.
Thank you so much. Senator Wagner, I hope that helped address your question from earlier.
It did. Thank you, Madam Chair.
Thank you. Any other questions for either of our staff? Yes, Senator Cooter.
Thank you, Madam Chair. Kevin, could you just give everyone an overview of the categories of people who served on the SURSAC work group, please?
You know, the SURSAC report is right here. I was not staffing this over the summer, and so I don't.
My name is Heather Kelly, and I'm the Criminal Justice Issue Chair for the League of Women Voters of Washington and the President of the League of Seattle-King County. I'm here on behalf of our members to ask you to support Senate Bill 5624. This is the right pathway for Washington because it rejects a punitive one-size-fits-all response to drug possession and instead focuses resources on prevention and life-saving treatment. The League has long been a stakeholder in this discussion. In 1991, the League of Seattle studied substance use disorder and developed a public policy position that supported a public health approach to addressing drug abuse. In 2000, the King County Bar Association began the Drug Policy Project, and the League was a part of that as well. Again, the project approach to controlled substance use, stressing a shift of resources to research, education, prevention, and treatment as an alternative to the continued use of criminal sanctions. In September 2003, we finally published a summary of those conclusions in Is It Time to End the War on Drugs? And that was almost 20 years ago. Now, almost 40 years after the League of Seattle first studied this issue, the evidence supporting a public health approach to substance use has only grown stronger. We heard the incredible range of skills, expertise, and experience among SURSAC's members, so I'm here to ask you to just let them lead us. We're out of time for further study. You can make policy based on how we think people should act, or you can legislate based on what we know actually changes behavior. People need to feel supported by this legislature. Senate Bill 5624 achieved that. Thank you so much, Chair Dinger, for bringing this bill forward, and thank you to the committee for your time.
Thank you so much. Caleb Green.
Good morning, Chair Dinger and committee members. I'm testifying in support of SB 5624 on behalf of the University of Washington. I'm Professor Caleb Green. I'm faculty in the School of Medicine, and I'm the director of the Center for Community-Engaged Drug Education, Epidemiology, and Research. I was appointed to the CIRSA committee and served as co-chair of the treatment subcommittee. Taken together, the sorts of recommendations will make substantial changes and improvements for prevention, treatment, recovery support, and harm reduction in our state. Community services for people who use drugs are not evidence-based and not desired by the people who need them most. Research evidence should drive our work, not anecdote. This is a once-in-a-generation opportunity to fix this broken non-system. A major recommendation from my subcommittee is the creation of health engagement hubs for people who use drugs. This draws from the model of care in New York State, as well as our research across Washington State that shows this model is extremely appealing to people with opioid and stimulant use disorder. It supports engagement and it reduces substance use. Health hubs are easily accessed in community-based settings and provide a broad array of healthcare and treatment services, including overdose and infectious disease prevention services and supplies. We've shown that treatment does not need to be coerced, nor the law used as leverage. ESB 5476 cannot be judged a failure since effective, accessible models of care were not launched in parallel to all the referral processes. If you think about the crisis of untreated substance use disorder and drug overdoses and the proliferation of extremely cheap fentanyl, we need to make treatment and related health services easier to get than a $3 pill off the internet. That is why health hubs are so vital to supporting recovery, reducing deaths, and reducing the chaos in people's lives and in their communities. Other CIRSA recommendations similarly aim to dramatically improve services and access to care, as well as enhance our workforce. Please move forward the legislation based upon the recommendations of the CIRSA committee. Thank you very much.
Thank you so much. And while we wait for the next one, on deck, we have Lisa Dugard, David Hayes, Brianne Beggs. Go ahead, Joshua Wallace.
Thank you, Madam Chair and esteemed members of the Law and Justice Committee. My name is Joshua Wallace. I am the CEO of Peer Washington, and I identify as a person thriving in long-term recovery from co-occurring challenges, and I'm testifying today in favor of Senate Bill 5624. I see 5035 in my name. I'm on that bill. How would you feel about an intervention model with an established 75% reduction in arrest recidivism for drug-related crimes? Would it impact your decision on how we can address this community impact in a meaningful way? First, a bit about me. I'm a person thriving in long-term recovery from co-occurring challenges for just over 17 years. I spent 6 years of my life on the streets of Seattle as an IV drug user with untreated mental illness. I was a good kid, raised to believe just say no to drugs, who endured almost daily, severe physical and sexual trauma. To understand the disease of addiction is to understand the genetic and environmental contributors to the chemical imbalances in the brain that characterize the uncontrollable compulsion to use a substance to achieve mental wellness for even a short period of time. Society told me not to talk about my abuse and the resulting mental illness. In fact, it taught me to feel shame and to keep it secret over seeking help. With one suicide attempt under my belt and a dwindling desire to live, all my logical defenses against drug use were meaningless. I needed help. The drug I took was the first treatment for what ailed me. In fact, it would later be the pharmaceutical drug prescribed for one of the conditions that I have. The stigma of behavioral health, abuse, and seek help, but to keep it a deep, painful secret eating at me. After 6 years of homeless IV drug use with untreated mental health, I was able to find recovery after the civil possession charge landed me in drug court. Peer work is essential to engaging individuals in their own recovery, thereby reducing recurrence of the disease. Intrinsic motivation always works better than the force and shame. In King County, we have been working with the BHS ASO to track the impact of our peer work and have been able to show a 75% reduction in arrest recidivism when people engage in our program. So I urge you to pass 5624 so we can focus on reducing the crisis through treatment rather than continuing to invest in the cyclical nature of criminalizing a disease. Thank you.
Thank you. David Hayes.
Thank you. Good morning, Madam Chair and members of the committee. My name is Larry Jefferson, and I am Director of Public Defense for the state of Washington. I'm testifying in favor of 5624. In general, we favor decriminalization. And the reason for this from the Office of Public Defense is that public defense has never been fully funded across the state. It will take money and resources to fund the district court and municipal courts. Right now, I did a survey of jurisdictions that need attorneys right now. We need 73, 44 for felony cases and 28 for district court cases. That's only a symptom of what we need. We think that this should be addressed as a public health issue and not a criminal issue. The other thing that seems to befuddle me is that I would argue that a person who has a needle sticking out of their arm and in a public place is gravely disabled. We already have laws that allow people to be picked up. I've done it myself. I'm a parent. I've used Ricky's Law myself. I don't understand why officers are not using the civil laws that we have. My presumption is that we haven't put in enough money into being able to civilly commit people who are gravely disabled. What we're concerned about is people being on the street and taking up our valuable parks and that sort of devastation that we don't need to see. We already have laws to help us do that. We just need to fund them. And so what I'm saying is I don't want more lawyers for money for this. But if you do, fully fund public defense all over the state so that we don't have justice by geography. Thank you.
Thank you so much. Go ahead.
Good morning. Well, good afternoon. I'm Sarah Hudson. I'm testifying on behalf of the Washington Defender Association and the Washington Association of Criminal Defense Lawyers. Thank you, Chair Dingra, and members of the committee for being here today and your work on this issue. Washington Defender Association provides support to public defenders statewide, primarily through training and case assistance. I, in particular, am an attorney who advises about the consequences of convictions on someone's immigration matters, as well as being a former public defender. What I would like to talk about today is the immigration aspect of this and what this does to people who are non-citizens, particularly that drugs do have additional consequences for people who are not citizens. In essence, they are doubly punished. Not only are they punished by the criminal system, but they are also punished by either being removed from the country or not allowed to proceed with their immigration case, even if they do have a valid pathway to status. Next, vacating a conviction will not work in an immigration court. Their definition of conviction is different than our state definition, and so it does not fully encompass those consequences for them. They could go into immigration court, and the immigration judge would say, I'm sorry, it doesn't have the magic language. We're still going to count that conviction against you. Third, diversion isn't created equal. Unless there's the magic language that is included that is immigration safe, not all diversion works for people who are non-citizens and sometimes could be a recipe for justice by geography. And last, 5624 will sweep less people into the net, less opportunity for double punishment, leaves pathway opens for people to keep their status or gain status. Thank you.
Thank you. While we wait for Jason to unmute, on deck is going to be Bob Cooper, Mayor Kelly, Matt McCourt, and Lauren Faringa. Go ahead, Jason.
Thank you, Senator. Good morning to you, Senator Dingra, and other members of the committee. I'm Jason Shores. I'm the director of the Snohomish County Office of Public Defense, and I'm testifying today on behalf of the Washington Defender Association and the Washington Association of Criminal Defense Lawyers. These agencies have signed in today in opposition to Senate Bill 5460, opposed to Senate Bill 5035, other on Senate Bill 5536, and in favor of Senate Bill 5624. We oppose the continued use of the criminal legal system and prisons as a means to achieve public health policy. We are supporting Senate Bill 5624 because of its very commitment to community-based treatment. Drug use is a health crisis. It's not a criminal one. And Senate Bill 5624 begins to respond to that medical crisis and also, importantly, to do so equally throughout the state of Washington. Currently, many citizens of Washington do not have access to sufficient substance use and mental health treatment. PA and WACTL's concerns with Senate Bill 5536, which we sign in other, is the very absence of investments in community treatment that will ultimately, we feel, undermine the bill's ability to rely on diversion We appreciate the use of pretrial diversion. We like that option. We like the option to vacate, but without investment in sufficient community resources, those individuals who are going to be sent to diversion will not be able to access them. And what we're going to end up having is the ability for folks who live in urban areas to get their convictions vacated, and folks in rural areas who do not have access to treatment to have convictions on their record or other legally negative impacts. So we, like Mr. Jefferson said, we want to avoid justice by geography. We want to avoid disparate outcomes by geography. Rural places, there are also fewer public defenders, fewer access to support services to help them resolve their legal processes, which is why we are in support of Senate Bill 5624. There's a lot to remember, sorry, and why we signed in other to 5536. Thank you so much. Happy to answer questions.
Thank you so much. Go ahead, Bob.
Madam Chair, members of the committee, thank you. For the record, Bob Cooper here on behalf of the Washington Association of Drug Courts. And let me say first, Madam Chair, that we completely agree with you that substance use disorder is in and of itself a public health issue. It is not a criminal legal issue. That said, as you meld these bills together in what I assume will be kind of a medley of what's in there, we also believe that this is not going to succeed, however you address this, without planning and funding a much more robust treatment and recovery support regime that addresses substance use disorder overall, and that cannot be zip code dependent. That has to be statewide, and it has to be fully funded. We believe that the sequential intercept model is the appropriate response to the possession of controlled substance. As behaviors escalate, responses escalate, but not at that initial stage where it is simply possession. Drug courts have their place in the system. Courts of limited jurisdiction have their place in the system. We urge that you also continue the funding that you had in the original Blake response with the $21 million that the governor is recommending be employed for courts of limited jurisdiction, while completely appropriating the criminal justice treatment account to fund drug courts as responses escalate. But funding, as much as we've heard today, it comes down to funding, 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 and it cannot be zip code dependent. If you are in Hump Tulips, you have to have the same opportunity for treatment as you have in downtown Seattle. You need to push with your colleagues, funding, funding, funding. This has to be paid for. Be happy to take any questions.
Thank you. And with that, we're going to move to Mayor Kelly. You can come up, and right after her is going to be Malika Lamont and Don Julian. Good afternoon.
Hi, my name is Lauren Faringa. I'm the founder and director of Hibina Veteran Foundation, as well as the marketing director for all veteran support services out of the Washington National Guard. We all see or are impacted by the issues on the streets, and so it's clear why you guys want to rush this stuff through. However, I want to address a serious flaw, and I guess the one that I signed up to speak on, 5536. If bills like that pass, we're putting the solution to addiction and lots of other mental health issues in along with the same category as the problem. And I'm speaking for those that are wearing uniforms overseas and currently still serving as police officers on our streets that aren't allowed to speak to this for themselves because of the uniforms that they wear. Sorry.
It's okay.
Because I was one of them. And as a combat medic, I had to give up my career after 14 years of service, thanks to the improper classification of cannabis and entheogenic plants like fungi. These are medicines that my grandfather, a professor of Chicano studies who wrote the curriculum on Chicano studies and Chicano gangs that everybody, anyone that takes a Chicano class right now, gets to read through, as well as my husband. We're both arrested for these medicines, and these plants have been honored as medicine by indigenous peoples and families like mine for millennia. Unfortunately, my spiritual beliefs and cultural traditions aren't recognized in the US, a nation I swore an oath for. In fact, they were exploited and criminalized. In the meantime, legal and expensive trauma therapies for my soldiers include ECT, which is absolutely barbaric. The gentle fungi plant medicines we grow on the ground freely all over the Pacific Northwest, which I'm pretty certain are outside right now, have already been deemed safe for human consumption by the FDA. For this bill to include them amongst the ranks of dangerous and addictive chemicals, such as heroin and meth, is not only inaccurate, it's harmful. Studies since the 1960s have proven that these plant medicines offer a direct and safe solution to the very issues that we are attempting to address. This is something that Indigenous peoples have always known and advocated for.
Thank you. Can I please have you wrap up?
It is unethical to ask our police officers to arrest people for the very PTSD treatments that they themselves will be able to access in the coming years. They also won't be able to forget the families that they tear apart, human beings trying to heal their own trauma.
Thank you so much. We're going to move on to the next two testifiers. I appreciate you being here.
Thank you.
And while we wait for them to come up, we are going to have on deck our next panelists, who will be Judge Ringus and Judge Rivera. Good afternoon. Go ahead.
Good afternoon, Madam Chairwoman. My name is Malika Lamont, and I am the director of the Lead Washington State Technical Assistance Team, as well as Vocal Washington, and I was a member of the SERSAC committee. I would like to come in as pro for 5624. This bill does what the legislature asked us to do in 2021, which was to build out what a meaningful response would be across the state. And we were told that there were initial investments into that infrastructure, and there was a lot of thought in creating parity around the state, and we have not been able to achieve that in 2 years, but that doesn't mean that we can't do it with more funding and more time. I think that we came in as other on 5536. We appreciate the removal of hindrances to site treatment facilities and the removal of criminal penalties for life-saving testing supplies. However, a gross misdemeanor will not save lives. An increased investment in drug courts that are notoriously biased will only deepen disparity against Black and brown people. No drug court in the whole state can demonstrate through published data that they meaningfully include people of color. Prosecutorial diversion programs are useful. However, we need to have pre-booking diversion also available for folks, because not everybody, arrest is harmful. Arrest is traumatizing, and increasing the depth of generational trauma is not going to help us in addressing the substance use crisis that we have. I also would like to add that homelessness is the main driver of public consumption of substances, and increased funding urinalysis and treatment does not address homelessness, but the recommendations that came out of the SERSAC do have recommendations directly related to that, and people that use drugs do not determine the drug supply, they use what is in the drug supply. Cartels determine that. So continuing to deeply penalize people that are suffering substance use disorder does not address the fentanyl crisis that we're experiencing in our communities, and that is what is driving overdose death.
Thank you. Go ahead.
Hi, my name is Don Julian Saucier, and I was formerly incarcerated for a drug problem. I am on the SERSAC committee as well, and as a person with lived experience. And a couple of points I just want to make sure that we point out is, and Malika kind of started on that, was that going to jail is a traumatic experience. And most people that are using substances have some sort of trauma that they're coping with or self-medicating for. And it's clear that adding trauma to trauma does not help trauma. It doesn't help solve the problem, the root causes. We need to allow people an opportunity to address the root causes and not add other consequences to them where they get stopped and they can't continue to work, they can't continue to live in their homes, they can't continue to have a life with, when they're being charged with a drug possession charge. It's time that we use a little more compassion and understanding that people just don't do drugs for the sake of doing drugs to be counter to things. They find some sort of relief in them and whatever they're dealing with. And when you are criminalizing an individual and adding that stigma and adding those burdens of a conviction, it sticks with people and it just adds hurdles and I think that's why there's so much recidivism and all that goes on. So that's what I'd like to say for now. I got more, but.
Thank you so much, and you're always welcome to submit written testimony.
Okay.
And with that, we're going to go to Judge Ringus, followed by Judge Rivera. So Everett's not here. The next person is Adam.
Hello, thank you. Hello, my name is Adam Paliu. I'm a PhD student at UW in epidemiology who studies drug regulation, and I'm an expert in epidemiology and drugs. I've also lost too many friends and loved ones to drug overdoses and other drug-related harms. I've seen firsthand the devastating effects that drugs can have on individuals, and I take the harms of drugs very seriously. However, I also take the harms of our drug laws very seriously. The Iron Law of Prohibition states that as drug prohibition becomes more severe, the potency of banned substances tends to increase. This is because drug producers aim to maximize the value of their product and minimize the risk of detection and confiscation. As a result, the drug supply becomes more dangerous. The reason people are currently dying in record numbers has less to do with addiction, as SAMHSA data shows that the vast majority of people who use drugs do not, but mostly because our current drug supply is unpredictable, dangerous, and poisonous. A regulated supply of drugs would provide individuals with access to a supply of drugs of known potency and quality. This has been shown to reduce the risk of harms associated with street drugs. Evidence in Canada and Switzerland have shown that these strategies greatly reduce the number of deaths, as well as other positive benefits, such as people committing less crime and being more likely to find and maintain stable employment. While regulation of the drug supply can reduce the harms associated with drug use, it is important to be cautious about how this regulation is implemented. The case of Purdue Pharma is a clear example of the dangers of this. Purdue Pharma and other companies aggressively marketed drugs and downplayed their potential for misuse. These actions have had devastating consequences for communities across the state. However, the current approach to our drug policy can be compared to the failed experiment of alcohol prohibition in the early 20th century. Just as alcohol prohibition led to a rise in organized crime, decrease in public safety, the black market for drugs, and the accompanying violence, the criminalization of drugs has created a similar situation today. The analogy of alcohol prohibition serves as a reminder that the criminalization of drugs has been tried before and has been shown to be ineffective and harmful. This is why Senate Bill 5624 and especially the Safe Supply Working Group are important. This group will work with community organizers, healthcare providers, and law enforcement to discuss the nuances of providing a regulated safe supply of drugs in the safest manner for our community, so that we can save the lives of so many people that we love and care for, and allow people the opportunity of one of the founding promises of this country, that of life, liberty, and the pursuit of happiness. Thank you, the committee, for my testimony.
Thank you. And while we wait for Jude to unmute herself, we're going to follow that by David Larson and Michael Transit. Go ahead, Jude.
Thank you, Chair Dinger and members of the Law and Justice Committee. My name is Jude Ahmed. I'm the advocacy organizer representing the Urban League of Metropolitan Seattle and the Tacoma Urban League, and I'll be testifying pro on Senate Bill 5624 and con on 5536, 5035, and 5467. The Urban League's mission is to empower and uplift the Black community through economic parity and empowerment. Our services include providing and finding houses for families in need, career development, job training, and access to healthcare services. Our clients include community members with criminal convictions or those dealing with substance abuse. And through connecting disparities within our community as more than just statistics, we know those most vulnerable by name. We believe that addressing the social determinants of health and helping community members meet their basic needs, we can uplift them out of cycles of poverty and violence. Senate Bill 5624 best addresses the overlapping issues of social equity, community reinvestment, criminal justice, public health, product safety, and quality control. However, policies like Senate Bill 5536 and especially 5035 and 5467 that punitively address drug use result in increase in racially disproportionate police contacts in our community and make it more difficult to access services, housing, and jobs. This is often due to criminal convictions and trauma that saddle our community members with a lifelong opportunity. According to a study in the Harm Reduction Journal by Zhang et al., the traditional policing approach, which typically involves prosecution and arrest for drug use-related crime, was associated with the risk of future fatal overdose and notable increases in the incarceration rate and average incarceration per person. We resist any efforts to criminalize our unhoused neighbors or increase punitive and inhumane drug policies that perpetuate cycles of violence for our community members dealing with addiction. Our lawmakers must listen to those with lived experience and experts from the Substance Use Recovery Services Advisory Committee by adopting the recommendations to decriminalize drug possession and increase investment in public health alternatives for people with substance use disorder. I urge the committee to adopt the SURSAC recommendations in Senate Bill. Thank you.
Thank you so much. Good morning, Judge Larson.